Have you ever considered that the cause of your bad breath or gum inflammation might be something you can't even see in your bathroom mirror? In my long experience, I've met many patients who came to me convinced they had tried everything: heavily advertised toothpastes, expensive mouthwashes, and the latest electric toothbrushes. But despite their best efforts, their situation never improved. And yet, a simple, natural solution, made with ingredients easily found at home, changed their lives and their smiles. One case in particular has always stuck with me. A 64-year-old man, visibly worn down and resigned, told me he had lived for years with the discomfort of persistent bad breath and bleeding gums. He had almost lost hope until he tried a natural mixture I recommended. Within just a few days, he started noticing improvements so significant he was left speechless. It wasn't some commercial product or a miracle potion, but a simple, effective, and above all, accessible natural liquid. Before we continue, I invite you to like this video, subscribe to the channel, and hit the notification bell. And if you're ready to commit to improving your oral health, write this in the comments. From today on, my oral health is a priority. In my practice, I've had the opportunity to observe the evolution of oral health in thousands of people: red, bleeding gums, loose teeth, pain while chewing. These are common problems that are often underestimated. And what surprises many is that the most dangerous enemy isn't a lack of hygiene, but what hides in the deepest, hardest to reach spots of your mouth. In fact, there are bacteria that live wedged between the gums and teeth, in areas where even the best toothbrush can't reach. These are anaerobic microorganisms capable of thriving in the absence of oxygen, and they produce irritating toxins like butyric acid, one of the main culprits behind bad breath. These substances don't just cause odor, they inflame the gums, damage the roots of the teeth, and trigger pain when you chew. Over time, if we don't intervene, these toxins crystallize and turn into tartar, a biological rock cemented to the tooth. This block of calcified plaque keeps the inflammation active day and night without a break. The consequence? The dreaded periodontitis with its destructive effects: tooth mobility, constantly bad breath, and bone loss. Another often ignored aspect is your oral pH. Eating too frequently, sugary drinks, chronic stress. All of these things make your mouth more acidic, and acidity is a breeding ground for harmful bacteria. It's a vicious cycle that few manage to break in time. Many only realize it when it's too late, when they can no longer eat without pain or find themselves at the dentist being told they need an extraction. That's why it's crucial to recognize the silent symptoms before the damage becomes irreversible. If you have one or more of these 6 signs, I advise you to act immediately. Persistent bad breath, even after brushing your teeth. Gums that bleed when you brush or bite into something solid. Swollen, sensitive, or receding gums. Teeth that seem to move more than usual. A dry or sticky feeling in your mouth, especially in the morning. Slight pain when you chew or touch your gums. If you recognize yourself in any of these points, don't feel alone. This condition is more common than you think. But the important thing is to know there's a solution, and it's often simpler and more natural than you imagine. So here are the 7 natural oral rinses that have revolutionized the oral health of so many of my patients. Let's start with the first 3. Rinse number 1, warm water and sea salt. It may sound basic, but the effect is extraordinary. After brushing your teeth, simply rinse your mouth for 30 seconds with a solution of warm water and half a teaspoon of sea salt. Salt has antibacterial properties and promotes osmosis. It dehydrates pathogenic bacterial colonies and reduces gum inflammation. The warmth of the water also enhances the absorption of minerals and soothes irritated tissues. A 70-year-old retiree who had resigned himself to bleeding gums told me he finally found relief thanks to this simple daily habit. Within a few days, the bleeding significantly decreased, and after 3 weeks, it was gone completely. His breath, according to his wife, also improved dramatically. Rinse number 2, baking soda. This remedy is often underestimated, yet it's one of the most effective. Baking soda alkalizes the oral environment, hindering bacterial growth in mouths that are too acidic. Simply dissolve half a teaspoon in a glass of water and rinse your mouth for 30 seconds before going to bed. A woman confided in me that despite using every type of pharmacy mouthwash, her breath remained unpleasant, especially in the morning. After two weeks of nightly rinses with baking soda, she noticed a clear improvement. The comment from her 8-year-old grandson, "You don't have that funny smell anymore when you kiss me," was the most important sign of change for her. Important, never scrub baking soda on your teeth with a toothbrush as it can be abrasive. Only use it as a rinse. Rinse number 3, diluted apple cider vinegar. Apple cider vinegar, when used with caution, can be a powerful ally. It contains acetic acid, which can reduce bacterial colonies, regulate pH, and help dissolve soft tartar before it calcifies. But be careful, it should never be used undiluted. The correct formula is 1 tablespoon in a glass of water, 2 or 3 times a week. One patient told me that after 2 months of regular use, his dentist noticed a visible reduction in his gum inflammation. And his own feeling? It's like my mouth can breathe better. You've now discovered 3 powerful rinses, simple but effective, and we're just getting started. In the next section, I'll guide you through the other 4, including ones with green tea, cloves, and a surprising solution also used in dental clinics. Get ready because what follows can truly make a difference in your oral health. Now that you understand the power of 3 simple natural rinses, let's move on to the second part of our journey. I'm going to introduce you to 4 even more surprising solutions, some of which are used in clinical settings that you can easily replicate at home. Their impact on oral health has been observed in dozens of patients with tangible benefits in just a few days. Healthier gums, fresher breath, and most importantly, a mouth that finally finds its balance and well being. Rinse number 4, unsweetened green tea or yerba mate tea. During my studies abroad, particularly in Germany and the Netherlands, I observed how many dentists recommended daily use of natural teas made from plants rich in polyphenols. The catechins in green tea and the bioactive compounds in yerba mate have powerful anti inflammatory, antioxidant, and antibacterial effects. The process is simple. Brew a tea by steeping the leaves for about 3 minutes in warm, not boiling water. Let it cool completely before using it. Rinse your mouth for 30 seconds in the morning, right after brushing your teeth. Let me tell you about a 68-year-old patient of mine who had suffered from swollen gums for years. She had tried aggressive mouthwashes, but the problem kept coming back. When I suggested she try a green tea rinse, prepared the night before, and used every morning, she told me that in less than 10 days, her gums had changed color and texture. My mouth feels like a completely different place, she told me gratefully. This type of rinse is particularly useful for people who suffer from dry mouth or want to maintain a feeling of freshness throughout the day. And if you also enjoy drinking these unsweetened teas, you're protecting your body inside and out. Rinse number 5, clove tea. Few people know that cloves, besides being a kitchen spice, are one of the most powerful remedies for oral pain and inflammation. The active ingredient that makes them special is eugenol, which is still used in dentistry today as a base for temporary fillings. But in its natural form, it's just as effective and much gentler. To prepare it, simply put 4 or 5 cloves in a cup of water and boil for 5 minutes. After letting it cool, use the strained liquid as a rinse twice a week, preferably in the evening. I'll share the example of a 67-year-old man who came to my office with severe chewing pain due to very advanced periodontitis. He didn't want to undergo expensive and invasive therapies. I advised him to alternate the clove rinse with other natural treatments. After 3 weeks, the pain had significantly subsided and his gums weren't bleeding like before. Today, months later, he has stabilized his condition without medication, just with consistency and persistence. An important recommendation: do not chew on the clove directly. The essential oil is too concentrated and can be irritating. It's much more effective and safer to use it as a tea, slowly releasing the active ingredients through the heat of the water. Rinse number 6, diluted 3% hydrogen peroxide solution. This is one of the most powerful tools for treating deep oral infections, but also one of the most misunderstood. Hydrogen peroxide has a broad spectrum disinfecting action. When it comes into contact with inflamed gums, it releases oxygen that helps fight infections, break down any pus, and regenerate tissues. But be careful, it must always be diluted. Never use pure hydrogen peroxide. The correct formula is half a glass of water and half a glass of 3% hydrogen peroxide. With this solution, rinse just once a week, preferably in the evening, as a deep clean. After rinsing with the mixture, always follow up with a second rinse of plain water to remove any residue. A 71-year-old woman I've been treating for some time told me she had suffered from chronic periodontitis for over 15 years. Surgery had been proposed, but she was very afraid. Together, we set up a routine that included using this rinse every Saturday night. After 3 months, the results were clear. The inflammation was reduced, her gum tissue looked healthier, and her breath had improved significantly. But what struck her most, was the newfound confidence with which she could talk, smile, and connect with others. This rinse is perfect to add to your weekly routine. Even just once every 7 days can make a difference, especially in cases of chronic gingivitis or periodontitis. But remember, hydrogen peroxide is not a substitute for your other daily rinses. It's a deep cleaning supplement to be used wisely and respectfully. Rinse number 7, cinnamon stick tea. This is undoubtedly the most aromatic and pleasant of them all, but also one of the most effective at controlling bad breath. Cinnamon contains a compound called cinnamaldehyde, known for its ability to reduce the growth of bacteria responsible for halitosis. Its warm, comforting scent also leaves a pleasant and lasting sensation throughout the mouth. Preparation is simple. Boil one cinnamon stick in a cup of water for 5 minutes. Let it cool, strain it, and use it as a rinse 3 times a week. It's important to use cinnamon sticks, not powder, to ensure an effective action without leaving residue. A 63-year-old patient of mine complained of very unpleasant breath, especially in the morning, despite frequent brushing and all kinds of toothpaste. After 2 weeks of regular use of the cinnamon tea, on Monday, Wednesday, and Friday, his wife told him, "Now I can smell you again, not the medicine." That small change made a huge difference in his mood and self-confidence. Furthermore, for those with diabetes or dry mouth, cinnamon is an excellent choice. It helps balance the oral flora without drying out the mucous membranes. Now that you know all 7 of the most effective natural rinses, the real magic happens when you learn to combine them correctly based on your symptoms. That's exactly what we'll do in the next section. I'll guide you step by step in creating a personalized weekly routine that's simple to follow and powerful in its results. And if you've made it this far, it means you truly care about your oral health. So put what you've learned into practice, and if you feel like it, support the channel with a like and turn on the notification bell. At this point, you've discovered the 7 most effective natural rinses to restore balance to your mouth, fight invisible bacteria, and reduce gum inflammation in a simple and accessible way. But now comes the most important part: how to put them together into an effective routine without confusion and tailored to the specific symptoms each of us may have. This is where many people go wrong. They try everything at once, without any order, not knowing when or how often to use certain rinses. And that's precisely what leads to poor results, or even worse, giving up altogether. Instead, I want to offer you a practical, personalized, and sustainable guide, a weekly map to guide you day by day, like a custom-made natural therapy. Case 1. If your main problem is bad breath, many people live with this discomfort in silence. They may brush their teeth well and use floss, but the bad odor persists, especially in the morning. In this case, I recommend a specific combination. Every day after your evening cleaning, rinse with baking soda dissolved in water. This is crucial for neutralizing the acidity that promotes bacterial growth overnight. Twice a day, morning and evening, rinse with warm water and sea salt. This helps reduce bacterial hotspots and visibly improves the condition of your oral mucosa. 3 times a week, e.g., Mon Wed Fry, rinse with cinnamon stick tea. Besides sanitizing your mouth, it leaves a fresh, pleasant breath without the artificial effect of commercial mouthwashes. With this combination, many of my patients have regained the freedom to speak up close without fear or embarrassment, a change you can't see, but you can definitely feel. Case 2. If you suffer from periodontitis, inflamed or bleeding gums, or loose teeth, this is one of the most common yet most neglected situations. People often get used to the discomfort, thinking it's normal with age, but it's not. With consistency, you can improve it. The recommended strategy is twice a week, alternate rinses between diluted apple cider vinegar and clove tea. These two are among the most effective for reducing inflammation, destroying aggressive bacterial colonies, and regenerating tissue. Once a week, preferably on a Saturday night, do a deep rinse with diluted 3% hydrogen peroxide. This is your intensive weekly cleaning, capable of disinfecting the deepest gum pockets. Every day, morning and evening, rinse with warm water and sea salt. This helps maintain your progress by promoting natural healing. With this routine, I have seen teeth that were loose become stable again. I've seen inflamed gums turn pink and firm. The key isn't to do everything in one day, but to follow the right strategy with patience. Case 3, if you notice your gums bleed often, especially when brushing, here you need to act gently but decisively. Bleeding gums should never be ignored. It's the first sign of chronic inflammation. Here's what to do. Every day, preferably after dinner, rinse with warm water and salt. The salinity helps stop microbleeding and decongests the tissues. After the salt rinse, to enhance the effect, a 20-second rinse with cool, plain water. This causes a beneficial vasoconstriction, which helps stop the microhemorrhages. Twice a week, use green tea or yerba mate tea, which are excellent for soothing and strengthening fragile gum walls. In many cases, following this strategy, bleeding drastically reduces after just 7 days and disappears completely after 3 weeks. Case 4. If you suffer from a dry mouth and an unpleasant taste upon waking. Nighttime oral dryness can have many causes, from medication to age to hormonal factors, but it can be managed. Here is the right routine. Every morning, rinse with green tea or yerba mate tea. These plants not only rebalance the bacterial flora, but also gently stimulate saliva production. 3 times a week, preferably in the evening. Use cinnamon stick tea. In addition to reducing bacteria that accumulate overnight, it leaves a pleasant natural aftertaste. Avoid aggressive or alcohol-based rinses, which will only dry out your mucous membranes further. Many patients with this condition have regained a more livable mouth, reducing that pasty morning feeling and even improving their quality of sleep. Now that you have all the information, I invite you to choose the combination that fits your symptoms. And most importantly, start right away because your oral health can't wait. And every day that passes without action is a day the condition worsens. My advice: don't wait for the pain to become unbearable or for your dentist to tell you it's too late. You can turn this around. You can save your teeth, improve your breath, reduce inflammation, and even regain your self confidence. And you can do it with natural, effective methods that are accessible to everyone. And remember this: your mouth is the gateway to your body. It's where your health begins, but also your energy, your desire to communicate, to smile, to live. If this video has helped you, I ask for a small gesture. Leave a super thanks below and share it with someone who might need it. It's a way to support the work of people like me who every day strive to bring you concrete, natural solutions, not with miracle promises, but with a real foundation of experience and passion. And if you've decided to start today, write it in the comments. I'm starting my natural oral health journey today. Remember, consistency, awareness, and care. These are the true ingredients of healing. You don't need complicated formulas, just the will to take care of yourself. See you in the next video. In the meantime, keep smiling and stay healthy.